And my friends over the last 20 years, 30 years, keep asking, when are you going to go back? They always know my heart has always been in Guyana. Even though I've been living in the United States, I'm doing everything over here, or wherever I've lived, my heart has always been, I want to go back. My father, he had a lot of dreams for his children. And of the last of 5, he always wanted us to go back to Guyana and do something for the country. He really, truly believed in his country. I think every time you leave your country, you leave something behind.
Midway Specialty Care Center is a comprehensive care center based in Fort Pierce, Florida. It began as a small infectious disease office and spread to 11 sites across Florida, lowering the infection rate of HIV at each location in the state. Every clinic offers comprehensive HIV care, primary care, and case management, as well as access to nutrition and behavioral health care, on the cutting edge of technology. Associates in Infectious Diseases, his private practice, sees 150 patients a day at 4 local hospitals, including Cleveland Clinic. Dr. Modi Ramgopal's father, Lalta Ramgopal, worked in the rice farming industry and worked his way up to become a prominent attorney. He brought skills and a desire to raise the country up, instilling in Dr. Ramgopal a love for his country and a dream of making it better.
The people are kind, are happy people, but the need for services is so lacking. I've gone to Haiti after the earthquake, I've gone to other places and do relief work, and I keep saying, why not Guyana again? But the future of Midway is going to be based about technology, artificial intelligence, and this is to some extent will feed into Guyana. Networking with the right people, take for example the Mayo Clinic. Mayo Clinic have a program of telemedicine and teleconsultations, which is what we'll be tapping into. Developing an electronic medical record system, developing or using tools that can understand patient care way before they have a disease state. Looking at 5,000 HIV patients, can we predict who's going to have cancer in 5 years? Can we have a program that's going to guide us with our strategies, minimal expenses, but maximal output? And then there's also, strong leadership from University of Maryland, another University of Miami, Cleveland Clinic. There are other organizations who may want to say, let's look at Guyana, let's visit Guyana, let's see, can we do something in infectious disease that can be sustainable, that can really impact people's lives. When you improve people's lives, you also improve the workforce as well.
Midway Research Center, established in 2005, has completed more than 150 clinical trials, with every new drug coming to the market for the last decade. As a result of the research, these studies have been published in the New England Journal of Medicine, The Lancet, the Journal of Acquired Immune Deficiency Syndrome, and Nature, to name a few.
I hope that we can have an outstanding research center where we can do extraordinary work with highly cutting-edge skills that we can bring into Guyana in the next 5 years. We can become a center for tourism medicine to some extent. I hope to have the vision of providing the best infectious disease services in the Caribbean, to make us the beacon of light for the other Caribbean countries to look at us. So my vision for Guyana doesn't end. It's just this whole spectrum of things that can happen. And the plan is for each center to expand. We want about 10 to 20,000 patients, about 10 to 20% of the population of HIV in Florida. Is it possible? We want to expand PrEP. PrEP will be taking a pill once a day, or maybe injectable PrEP. So when I talk about the vision for Midway, can we be the center that has the cure that will be spread all over to Guyana, to Florida? Are we going to be one of the leading organizations to do this? That's exciting. Hopefully we are, or we will be.
For Guyana, they're getting the best. And that the people of Guyana are going to be very fortunate to have him and his knowledge and his staff down there.
But I've built up over the last 20 years story around myself that I think I have the confidence to do this now. I have the team around me to do this. Before I would do this on my own. Now I'm not. I'm building this whole set of people behind me saying, let's do this, we can do this, let's look at the infrastructure of healthcare. Can we change Guyana's healthcare in a positive way? Can we look at other Caribbean countries and change the same way? Why can't we lift the healthcare status a little bit, as much as we can, as an organization to do this?
Midway Specialty Care Center, lifting the quality of HIV and infectious disease care in Florida, and now in Guyana.